little thing that implants have also started to come in on is an implant retained denture, which is tremendous because the bone stays around the implant.
Okay.
A lot of times the dentures just snap into that.
Yeah, snap in means, yeah, they can remove the complete lower,
Yeah,
even though they have an implant,
that's right.
right? It's like, are you talking about mini implant?
Sometimes mini implants are, they have, mini implants are good for patients who might have had dentures for 20 years and now their bone is reduced so
Okay.
much that they don't have a lot of bone for a regular sized implant.
Okay.
And so a specialist might place a mini implant, which does not require to be so deep. However, its retention is just as good because, as the literature shows, the ratio of bone depth that doesn't play that much of a role with implants. They're really a tremendous asset to the dental profession.
Do you think also implant is usable in a partial denture?
Yes, absolutely. It's a great. That's even better in a lot of ways because partial dentures are also relying on other teeth. So as a result, when you bite down, the force of your bite, when a partial denture is wrapped around natural teeth, tends to loosen those teeth over time because they have this. You have a tremendous amount of force when you bite. So essentially, you're pulling those teeth eventually out. And implant retained partial dentures are great too because they also can snap in and they don't require the support of the other
Okay,
teeth.
so implant retained denture. Is
Yeah.
that what you call that? Instead of putting a clasp or like
Around
a
the
hold
tooth.
around the tooth,
Yep.
then you have an implant besides the natural tooth,
That's right.
and then the partial denture will snap in there.
That's right.
Okay.
And it works great. It's more economical because you're replacing multiple teeth, and at the same time you have a couple implants in there that snap it in, and you have a great result. And you can snap it
Okay.
out and clean it too.
I think the disadvantages of that is very expensive, huh?
It can be, but I'll tell you, it's definitely worth it
Yeah.
because you have your mind at ease.
Yeah, okay. I want to discuss about recession.
Okay.
You know, the recession, tell me about the recession when you brush your teeth. So you're indicating use soft toothbrushes.
Right.
And about that electric toothbrushes, you know, like if you have that abrasion on the neck and it's becoming so sensitive, so the patients will say, oh, it's very, very sensitive. I brush too much. So tell about, you know, the viewers about the recession.
Well, you know, nowadays I think if you walk into a drugstore, you probably won't really see differences in the hardness of brushes. It'll be soft or extra soft at this point. Back, you know, maybe 10 years ago, it used to say you could get a brush that would be hard, medium, soft. Nowadays, you can take the hard and medium brushes and use it to clean the tile grout in your bathroom or whatever. There's really no reason for it anymore when it comes to your teeth. So a lot of times you at this point, even with an electric toothbrush, as long as you're not pressing too hard, there should not really be any major cause of recession by what you're doing. Sometimes, though, that recession can go misdiagnosed, and essentially, a lot of times it has to do with, again, bruxism, TMD, because as you know, the enamel around the neck of the tooth is thinner than it is on the top, and you might see somebody who's wearing down their teeth on the top and also has the same wear around the neck of their tooth at the gum line.
When do you indicate the recession to have a filling? Let's say on the front teeth, if they have a gum recession, and actually you can see that, you know, the second part of the tooth, which is the dentin, is showing, and they are almost near to the nerve tissue.
Right.
Do you indicate them to do a white filling?
Yes,
Or
we
do you
usually
ignore it?
No, we usually do a bonded filling there, or we send them to the periodontist maybe to determine if they need a graft in that area. If it's possible, then they can have a graft instead of a bonding, because it's much more preferable to bring the tissue back up to where it's supposed to be, rather than put a little composite filling there that's going to be very aesthetic, but you didn't really take care of the recession issue. If you couldn't bring it up, it'd be much more preferable. But
Yeah.
either way, you don't want the tooth to wear down to the point of getting to the nerve of the tooth.
Right, yeah. So he's talking about grafting, you know, a soft tissue grafting. Like if you have a gum recession, especially if it's only localized, meaning 1 or 2 teeth, then instead of putting the filling on, then you indicate a grafting, like a soft tissue grafting,
That's
or
correct.
we call it connective tissue grafting
That's right.
in a dental term. You know, especially if you have a crown, and because you brush too much, and then it's showing the neckline, it's showing the metal, then you
Sometimes
indicate the
underneath, yeah.
grafting, or you indicate to redo the crown.
Right, sometimes you have to redo the crown if that's the case, but at the same time, then that tooth might really look very long and not be the most aesthetic result that you want. So sometimes it's better to bring the gum back to where it belongs.
Okay, all
But
right.
that's only if it's possible. Sometimes the gum loss is associated with bone loss. The gum
Bone
follows
loss, yeah,
the bone.
okay,
So
yeah.
if the bone is
The
away,
bone follows, what did you
the
say?
gum follows
Okay,
the bone.
the gum, so the gum follows the bone.
That's right.
Okay,
in
so I
other
just
words,
want to
if-
tell the
yes,
viewers about that
because
one, you know?
Basically, if you have a lowered bone level, then you'll have a lowered gum level.
Okay, all right.
This is an intraoral camera that we like to show patients as a diagnostic tool what's going on in their mouth, what we see, and many times in the posterior area, patients have no clue. You say, there's a crack on tooth number 15, and they have no idea what you're talking about. But this little camera here does a tremendous job of showing the patient on the computer screen, on the monitor, what is exactly going on and what exactly you see and why something needs to be done versus leaving it alone or whatever. It's a great little tool that I think every dentist should have. This is a veneer, an example of a veneer, all porcelain, with no metal underneath it, so it comes out as natural as it can possibly look and aesthetic as it can possibly be. And essentially, you can see on this side here, this is pretty much what a crown would look like on the same exact tooth on that side. A veneer is essentially half a crown. If I turn this around, you can see that the back side of the veneer, of the tooth itself, has not been touched. And very durable material, very long lasting. And a luminaire involves very little reduction, whereas this veneer, you can see, has about half of a crown reduction, half of a tooth reduction on it. And a luminaire typically has a minimal amount of reduction, if at all, and it has a great result if you qualify. If, in other words, there's if you're a good candidate, not if you qualify like for a loan or something like that. Just that if you have the room for it and it's indicated, then we'd love to do it as a restorative dentist. This is a diode laser that is used by many dentists, many restorative dentists. There's a ton of things that you can do with a laser. Sometimes you can do a filling or a very minor invasive filling. However, this is a soft tissue laser. So in other words, a lot of times you want to contour the gums on an aesthetic case, like veneers or something to that effect. Or some people need a frenectomy when they have a big space in the front of in the two front teeth. There's a little muscle attachment of the lip that you can remove with a laser and is not as surgically involved as without using a laser, which usually involves a scalpel. As a result, the laser has a much more has a better effect when it comes to recovery. You really just get the patient numb. You remove the little freedom with the laser, and afterwards there's very little recourse. There's no soreness really associated with it, and so as a result, it's got a tremendous advantage over using a scalpel and then suturing the patient. And I use this typically for aesthetics cases, and frenectomies is what they call that. Along with many times when you do crowns, this is a nice little tool to just isolate the area and dry it out. Also, hygienists can use this for deep scalings, and they can get down really deep and remove the tartar buildup that is very low. And also, again, it's less invasive. So a laser has tremendous advantages when used correctly.
All right. I think I have no more questions.
Nothing?
Maybe you can ask me. I don't know if I'm going to answer you. But anyway, Dr. John Pappas, I know this is a long interview. You know, I interview a lot of people now and they have their own specialty. But I think general dentistry has a lot to ask. And I think I cover everything today. And Dr. John Pappas, I appreciate so much of letting me to come to your office.
Oh, thank you. It was my pleasure.
Yeah, thank you so much,
Thank you.
And to the viewers, I have a next episode that I would like you to watch because I'm going to interview an endodontist and maybe an oral surgeon. And have a nice day.